The Solid Waste Management Program promotes environmental protection through proper waste handling and disposal. Every piece of trash we throw away, whether biodegradable or plastic or non biodegradable, has an impact on our health because it also impacts our environment. Solid waste management ensures that communities practice segregation, recycling, and safe waste management to prevent both pollution and disease. In the Philippines, this program is guided by Republic Act 9003, also known as the Ecological Solid Waste Management Act of 2000. This law provides a comprehensive framework for managing solid waste at every level, from households to LGUs. So, when we talk about solid waste management, we are not only referring to garbage collection. We are actually talking about health protection system, a process that keeps our homes, barangays, and our whole community safe from disease and environmental degradation. Proper waste management is important because first, it prevents the spread of communicable diseases, most particularly vector borne diseases. Uncollected garbage provides breeding grounds for flies, mosquitoes, and rats. These are vectors that spread diseases like dengue, leptospirosis, and other illnesses. Second, it protects our soil, water, and air from contamination. When waste is dumped improperly, chemicals seep into the ground and pollute our water sources. Open burning of garbage also releases toxic fumes into the air, affecting respiratory health. Third, solid waste management promotes a clean, safe, and sustainable environment for everyone. It reflects our sense of community, responsibility, and discipline. That said, let us not forget that a healthy environment is a direct reflection of healthy people. These are the goals of the Solid Waste Management Program. First is to reduce the volume of waste generated in communities by encouraging smarter consumption and responsible disposal. Second is to encourage recycling and reusing of materials. For instance, plastic bottles can be reused and biodegradable materials can be composted to be made into fertilizer. The solid waste management program is also to promote segregation at source. This means that waste should be segregated right where it is produced, most often in the household, and ensure proper disposal of residual waste in sanitary landfills. As CHNs, understanding these goals help us guide our communities toward sustainable habits that promote health and environmental stewardship. Now, what are the components of the solid waste management? One is waste segregation. This is sorting waste into biodegradable, non biodegradable, and recyclable categories. This makes recycling easier and minimizes contamination. Waste reduction. This is implementing the three R's: reduce, reuse, and recycle. Reducing waste begins with choosing products wisely, reusing what we can, and recycling what is still usable or useful. Next, we have waste disposal, establishing sanitary landfills for safe final disposal and composting systems to handle organic waste. Composting turns biodegradable materials into soil nutrients, reducing waste volume and supporting sustainable agriculture. The Ecological Solid Waste Management Act of 2000, or RA 9003, serves as the foundation of our national waste management policy. This law provides a systematic, comprehensive, and ecological waste management approach, ensuring that waste generation, collection, transport, and disposal follow proper standards. It mandates LGUs to create and implement a local solid waste management program suited to their community's needs. It also requires each barangay to form a solid waste management committee that oversees segregation, recycling, and proper collection. RA 9003 is one of the best examples of how policy, when properly enforced, can improve both environmental and public health outcomes. The local government units, or LGUs, are the primary implementers of the waste management programs. They oversee collection, segregation, and disposal systems within their jurisdictions. The Department of Health, on the other hand, ensures that health standards are observed and that waste related risks, such as disease transmission, are monitored and addressed. At the barangay level, local leaders must establish MRFs, or materials recovery facilities, where waste is sorted, recycled, or composted before final disposal. These roles show that effective waste management requires coordination between multiple sectors, with community health nurses often serving as educators and advocates. Community based participation is key to the success of the solid waste management. Many barangays hold cleanup drives and eco friendly contests that promote community cooperation. Waste segregation campaigns in schools and households help instill discipline and environmental awareness among children and families. Partnerships with NGOs and civic organizations support recycling projects and provide resources for environmental education. Why is solid waste management necessary? Because there are health implications of poor waste management. Again, uncollected garbage become breeding sites for vectors. It also leads to contamination of water sources, which can cause diarrhea, cholera, and other gastrointestinal diseases. Lastly, open burning of waste releases toxic gases, contributing to air pollution and respiratory illnesses, such as asthma and bronchitis. So, poor waste management is not just an environmental issue, it is also a public health hazard. As CHNs, we educate families about the importance of waste segregation and composting, which are simple but impactful daily habits. We monitor community cleanliness, ensuring that unsanitary conditions are reported and addressed promptly. We promote eco friendly habits and advocate for proper waste disposal in health facilities, which is crucial for infection control. As environmental advocates, nurses can collaborate with LGUs and schools to organize cleanup campaigns or environmental awareness programs. We can also advocate for sustainable and health promoting waste policies, ensuring that local ordinances align with RA 9003. It is most importantly, we must model environmental responsibility in both our personal and professional lives so that communities see that change starts with example. Several challenges are still faced despite progress on the solid waste management program. First, there is still a lack of awareness and compliance among households, especially in rural and low income areas. Many LGUs have limited resources for collection and disposal systems. Garbage trucks and MRFs are often insufficient. Then there is poor enforcement of environmental laws and ordinances, which reduces the program's long term impact. To strengthen the implementation of solid waste management, here are some strategies. First, strengthen environmental education and advocacy. Raise awareness through barangay seminars, school campaigns, and partnerships with the media. Develop community partnerships for waste reduction, linking LGUs with NGOs, businesses, and civic groups. Integrate solid waste management into health and sanitation programs so that waste education becomes a routine part of health promotion. Solid waste management is not just about cleanliness, it is about protecting health and preserving the environment. Community participation and LGU enforcement are essential to the success of the program. And we, community health nurses, play vital roles in education, monitoring, and advocacy. That is to ensure that every household understands its role in keeping the community safe and sustainable.